The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and we're glad that you've joined us today. And I think today's program is going to be especially helpful to many people. Over the last number of months, there have been all kinds of natural disasters, and these have a big effect on our health, both physically and mentally. And today, to talk to us about this problem and some solutions is a psychiatrist from Pittsburgh, Pennsylvania, Manjula Borge. And we're glad that you're here with us, Doctor.
Thank you for having me.
And you have gone through a residency now in adult psychiatry, and you're now working on another fellowship, it's called, in child and adolescent psychiatry in Pittsburgh.
Yes, that's right.
And so you've had a lot of experience talking with people, and you told me before the program that you were very interested in doing this program because you felt like you wanted to give something more than just a donation. You want to help people that have gone through the trauma.
Yes, well, I was interested, especially after the recent hurricanes that we have experienced here in the United States, Katrina, Wilma, the natural disasters overseas, the earthquakes in India and Pakistan, and other natural disasters that have been occurring and on the increase, actually. So I was just interested to find out what kind of mental illnesses one can experience after these natural disasters and what we can do as professionals and as lay people to help individuals who have been traumatized.
Yeah, and as we've gone through some of this material beforehand, I know it's going to be very useful. You may want to get a pen or a pencil and write down some of these thoughts. I think you'll really enjoy the material. Now, I guess the first thing we need to talk about is how to define a disaster or I guess we'd call it a trauma. And what is the definition for a disaster or a trauma?
Yeah, so, well, after any person who has experienced or witnessed any event such as combat, rape, torture, natural disasters, accidents, in which the physical integrity of them or others was threatened, has experienced what is called a traumatic stress reaction. So they can experience it or they can even witness an event where death was involved or physical injury to themselves or others.
So September 11 would have been a traumatic
Sure.
thing for the entire country.
Absolutely.
Watching some television programs might be that as well.
It could be for some people, depending on how a person reacts. If you see other people, dying or experiencing very horrible events where their life was threatened, can experience traumatic stress reaction.
But we're talking about these huge hurricanes and different things, whether it be in Sumatra, where some people may be watching, or wherever they are. These are called traumatic events. What are some normal reactions to a traumatic stressor?
Yeah. Before going to the normal reactions, I'd also like to talk of some other experiences where people can have where they can experience trauma.
Okay.
For example, if a person is an EMT worker or a policeman or a fire worker or a person who is taking care of a medical personnel working in burn units or trauma units where the stress level is very high and mortality is high, they also have experienced what we call as trauma. So
So this is a wide spectrum of people that could be impacted, and what you're going to be sharing could help all these groups.
Sure, it can be people who go to help out and help in the trauma after a disaster, that they also can experience it after seeing injury or death.
So what are some normal responses then to traumatic
Well,
events?
some normal responses, we can talk about some emotional things that people can go through. Emotional reaction is shock. People are very shocked of, how could this be happening to them? Is this real? This could have never been happened. They might have felt secure in whatever situation they were in, and now that's all shattered, and they feel very shocked, and they go through sometimes what's called even denial, that this is not happening to them, or it can't be happening, this is unreal, it would have never have happened to me. So they can go through denial. They can go through a lot of anger that this has happened to them, or why, when things were going okay, how come this can happen, something making it worse. A lot of resentment, a lot of hate towards authorities, or towards people who are maybe not necessarily responsible, towards people who they think could have done a better job. And so they have a lot of hatred involved with that. Sometimes they could have a lot of guilt that, they could have done something better. They could have, gone away from the trauma sooner, or they could have, called someone, or they could have done something. They feel a lot of guilt involved with the trauma.
Well, this is certainly what we heard as we listened to people going through these natural disasters. I mean, listening to the interviews on television or reading about it, those are exactly the things that were being said.
Absolutely. They feel a lot of, guilt that they were not able to evacuate maybe earlier, or didn't think earlier. And they also could go through a lot of fear. Fear is very, it's a normal reaction. It's normal to be fearful after what has happened. And fear can bring a lot of anxiety about, feelings of whatever is going on around, whatever the chaos is around, that can
So
be
these
a
are all
huge
normal.
problem.
These are happening. That's healthy.
Yes.
What about
Yes.
physical things? Are there other physical things?
Yes, they can go through a lot of physical problems. They can have a lot of tension, muscular tension.
And that's normal.
Yes, fatigue. People can get tired very soon. They can have a lot of somatic complaints, abdominal pain, nausea, feeling distress, diarrhea. They can have sweating. They can be anxious. They can have what is we call paresthesias, or difficulty in sensations for the extremities. They can have paresthesia or numbness. Yeah, this is normal.
Okay.
And so the person might be wondering, like, what are they going through? Why are they feeling this way? And they just need to realize that after seeing a devastating event or events, that they can experience this physical symptoms. They can have headaches. They can have dizziness. They can have some emotional, cognitive problems.
Okay, what about interpersonally?
Interpersonally, they can have a lot of relationship issues. They can have a lot of relationship problems with their spouses, with their families, with their children, because of the stress. For example, middle-aged men, they might feel that they need to, take care of their family, or should have been there, and they feel this overwhelming stress now that things have fallen out of control, and they feel loss of control, and this makes them very angry, and makes them probably more argumentative with their spouse, or more edgy with their children and with their other family relatives. They can also have a lot of depression. Depression can be there. And people can have a lot of feel hopeless, very hopeless, very shameful of what has been happened, what's going on. They can feel hopeless, they can feel helpless, they can feel lonely, they can feel abandoned.
And these are all normal things.
Yes, absolutely.
What
These
about
are normal.
spiritually? Are there some spiritual things that happen?
Spiritually, yes. People can wonder, get angry. Some people can get angry with God and wonder why this happened to them. They might blame God and say that, why did you let this happen to us? Why did my child have to die? Why did this natural disaster have to take place and my family, was lost? So they can have a lot of anger towards God, a lot of hatred, a lot of resentment towards God, a lot of questioning God, like, why are you doing this? Some people might feel guilty that they did something, they lived bad lives, and then this is their punishment received from God. But I think there's another spiritual aspect also after natural disasters that can happen is some people's relationship with God can get closer. They might look at it as a sign to get closer to God, and they might think that their lives were not good enough and God is giving them a sign to improve their life, and they might start going more to church, become more spiritual, start praying more. So I can see that too. Yes, absolutely.
So these are just normal reactions. What are the risk factors when going through a traumatic event?
Several risk factors that when you have a loss of a neighborhood or community or family,
that describes Katrina, doesn't
absolutely,
it? Yeah.
Yes. One time you will be near your child, and then next thing you might not be able to see your child or your family. That's very devastating to somebody.
Yes,
and so loss of communities, support from family, loss of property is another risk factor. If you come and see your house,
gone.
which is totally gone.
Yeah, I heard these people, they were saying, look, this house has been in our family for 400 years and now it's gone.
Sure, absolutely. When you see something that was a place of security, a place of attachment for you, and then you see it in shambles, it's very devastating to have some kind of illness after trauma. So those are some of the things. You could also feel if there is a risk to the health of the person from the environment. It could be like, loss of water supply or shelter. That can be also another factor.
Now you said some of the other things were fear for safety.
Yes, yes.
Fear of death.
Absolutely.
Or injury.
Sure. Seeing dead bodies, seeing people being injured, not knowing that if you can get out from here without being injured is definitely a risk factor for developing trauma afterwards.
Bringing up old traumas that were pre-existing?
Sure. Previous history of traumatic experience is another risk factor for developing another trauma. So history of traumatic experiences, having medical conditions before that can be exacerbated, so your health conditions can worsen, psychological distress.
What about relationally? Divorce, job loss, separation, all those things?
Absolutely. If someone has experienced that before, a divorce or job loss, that is a risk factor for developing mental illness after trauma.
We're talking with Dr. Manjula Borge. She is trained in psychiatry, both in adult and now a fellowship in child and adolescent psychiatry. When we come back, we're going to talk about what the impact of trauma could be on children and what we can do now to help with these situations. This is a very important program, and I know it's going to be a great help to many people. You may want to give someone a call and have them tune in right now and join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call her right today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call her right today.
Welcome back. We're talking with Dr. Manjula Borge. She's a psychiatrist from Pittsburgh, Pennsylvania. And we're talking about natural disasters and mental health. We're talking about what can happen with a trauma that can come to people. And doctor, we were saying that this trauma can really affect in many different ways. There's some natural things that come up, and if those things are happening, you describe that that's good. I mean, those are good signs. That means that you're not blocking it, and you pay a cost at some time, but you're really addressing those things. And then secondly, you went through some of the negative things that can happen.
Sure. It's very important to keep in mind that a person can experience these normal reactions after a traumatic event. Because, if they're going through it and they might feel that, what is happening to them, the trauma is probably like clearing or, getting better, but they're, losing it or going crazy. But, one should be aware that there are certain natural and normal reactions after a huge traumatic event.
And some of those were eye-opening. I mean, like numbness in the extremities and not feeling them. And some people think, what is that? But it's normal. And then what about children and trauma? Are there specific things for children and trauma that you want to share?
Yeah, as you can imagine, children are very vulnerable to trauma after disasters. And according to the American Psychological Association, between 14 to 43% of children have experienced at least one traumatic event in their lifetime.
Wow, that's a lot.
Yes,
is that up
it
from
is.
before?
I'm sure it's on the rise, because especially after these natural events that we're witnessing. So the way children experience their trauma is, can be a little bit different from how adults experience them. And we need to be aware of that. I think parents, teachers, and those who are working with children definitely need to be aware of that.
Well, let's click through some of those real quick so we can put it in the mind, what we need to be aware of. What should we look for?
Sure. Children might not want to do their homework. They might
That sounds like
not be
something they
interested.
don't want to do anyway.
No, well, if a child, it could be true to some point, but if a child has been previously going to school, doing their homework, and then you start noticing that the child is not interested. The child might not express that they're afraid after the trauma. They might even say that, no, I'm not afraid. But you can notice other differences going on, like, for example, not doing their homework, not wanting to go to school. You can see what is called separation anxiety. Children
don't want to leave their parents. They want to be together.
Absolutely. Yeah, you can see that. Sometimes we call what is called avoidance. They might not want to talk to people or be in places or have conversations. Anything that reminds them of the trauma, they might want to avoid them. And the way children show that could be very, very subtle. The adults might not definitely recognize it. For example, a child who has cornflakes for breakfast might not want to eat cornflakes anymore. So this might be, taken as for the adult, it might be seen as, why is this child not eating breakfast, And it might be looked at as nothing related to the trauma, whereas the child is showing his or her anxiety through that way. Another example is a child who has been through, let's say, fires. And after that event of the fire, they might want to set fires.
Actually, physical fires.
Yes.
Better keep on top of that.
Yes, absolutely.
Right.
And one needs to be aware that they're not trying to worsen the situation or they're not trying to make things worse. But this is their way of reenacting the trauma. This is the child's way of reenacting the trauma. For example, after a hurricane, a child might come home and might start, twirling, play as twirling around or hiding under furniture. So this is the way of how a child is expressing what they understand of the trauma.
And your definition of trauma, can be from television programs and other things, and especially probably the younger the child, the less able they are to see whether or not that's real or not. So it's very dangerous, maybe, would you say, to have kids be watching television when they're young?
Absolutely. You know, I think parents need to be aware of what their children are watching, and they need to be aware of how much their child can handle watching on television. You know, if your child is very sensitive, very vulnerable to you know, things that are distressing, the parents need to be aware of that and you know, not show those kind of things to the
Have them
child.
watch 3ABN.
Yes, that's a good idea.
So you said also that there were different ages and different categories where they respond a little differently.
Yes, children, for example, younger children, let's say lesser than 5 years old, might regress, and they can regress in ways such as if they were toilet trained, they might start bedwetting again. So that's important to keep in mind, because parents should not be very critical about it or over anxious about it. They should be supportive to the child and realize that the child is, you know, going through a period of distress and anxiety, and that's why they're they're doing this. Another thing that the child might do is become very clingy, very needy, very helpless, become very childlike.
0 to 5.
Yes, yes.
And then the next category up, older than 5, elementary school.
Elementary school kids might not recall memories of what happened of the event. They might just
Block
blank
it out.
Absolutely.
Okay.
So this is not that they are, you know, going through. It just might be that they don't remember certain aspects of the trauma. They're not able to recall certain aspects. They might also go through. They might not want to do their homework, like I mentioned earlier, and they might also become very aggressive.
These are adolescents now.
Yes, they might become aggressive. They might also become very spacey. They start staring and start getting blank spells. That could be.
They might think of suicide?
Adolescents, definitely, yes. They might think of suicide. They might become depressed and suicidal. They might start using drugs and alcohol to deal with their anxiety. And like I mentioned, they might also become very argumentative and aggressive. That's the adolescent.
So, Dr. Borge, we've talked about the signs and symptoms. We've talked about what can happen. Look, I'm listening here and I'm saying, that's exactly what's been happening. I've seen it in my congregations as a pastor. I've heard about it. I've seen it on television. This is exactly what people are going through. Now, you know, we focus more on children. We maybe do another segment together focusing on adults, but we focused on the kids. What can we do to help them? What's the treatment in our last 5 minutes?
Sure. It's very important to educate the children and let them know what has been happening, what is going on, tell them about the disaster, so that they're not in the blind, they're not feeling in the, you know, feeling that they're in the dark. So children can pick up anxiety by adults very quickly, and I think if a person is anxious and nervous and tries to, you know, not minimize the situation, I think that's not a good idea. You need to express to the child what is going on, educate the child, and also need to give them hope that, well, this has happened, but this is what we're trying to do to get things better. So that's very important part. Getting them in a normal routine is very healthy. That gives them sort of a structure in their life. For example, school is a good example, you know, taking the children back to school and letting them do their regular schoolwork is important. Educating the teachers is important. If a child has been through a trauma, you know, they might be more anxious or might be more irritable, and teachers and educators.
They might start a fire, like you said.
At school, need to be aware of that, and so that they can understand the child's reactions a little bit more. Another way of giving control to the kids is allow them to pick up their clothes, you know, allow them to choose a menu for their meals, so that gives them a sense of control. If a child starts to cry, that's okay, you know, allow them to cry and express what is going on. Just be sympathetic and understanding. And what adults can do also is help themselves. Studies have shown that if close adult to the child is very anxious and nervous and hopeless, there's more chance for the child to feel the same way. Whereas if the adult is more in control, hopeful, and positive, the child is also going to feel that way. So what adults can do is take care of themselves. They can exercise, they can take care of their health, get into better routines so that they will not transmit this anxiety and fear and more trauma to the child who has already been traumatized with whatever is going on.
So give them a sense of safety.
Absolutely. Safety is very important. Safety is first. You have to protect the child from any further trauma.
So what about the person that's watching and says, that sounds easy, go out and exercise, take care of my health and nutrition, but I don't have a house, I don't have a grocery store, I don't have this, I don't have that. Mm-hmm. What do you say to that person that's going through that right now?
Yeah, well, it's important to get in touch with your family, with the community, and with the resources that are available. That is key, to find out, get the source of information, find out what is going on and what they need to do to help themselves. You know, if you feel hopeless and if you feel that, well, I can't do anything, then chances are for you to recover are more difficult. But if you go out there and get the resources that are available, you're helping yourself, you're helping the people around you, and that's very important. So being hopeful, going out and looking for the resources and getting that is very important.
Now, you talked earlier about different ages of children. Is there a different way to educate a 0 to 5-year-old versus an elementary school versus an adolescent? Are there different ways to go about that, or is it pretty much the same for every age?
No, I think, different ages, their requirements are different. For example, a child for 0 to 5 years might not necessarily need to know what is going on around or what is the impact of the situation in detail compared to an adolescent. So you can still explain to a younger child what's going on, but in simpler terms, in terms that they can understand. You can allow them to draw, to express what is going on, and draw something that has happened, like if it's a hurricane or something, explain to the child in simpler terms. They understand pictures much better, and you can have what they call at schools now, they're having, after Katrina, they gave the teachers Katrina handbooks so that the children can draw and color in that, so that they can learn through that way. Whereas for adolescents, more they might not be interested in that, and they might want to talk to you and find out more what is going on, so you can explain to them things a little bit better in detail.
Are there any spiritual resources that those who've been through trauma should consider?
Absolutely. I think prayer is very important. Prayer with your family, with your community. If you do that with the school, you need to increase the time that you do this so that you will feel strengthened.
Normal routine and just drawing strength from your normal ritual.
Absolutely.
Thank you so much, Doctor, for being with us. And this has been very useful, and we appreciate it. And thank you for joining us on Health for a Lifetime. Hey, if you've been through trauma, we're praying for you, and we hope this program has been helpful.